Hey, Dr. Matthew Korn here, 65 Plus Center for Active Aging, here with your weekly rounds. Today is May 8th, Friday, May 8th, 2020. And it was a very different week for us here. We had our first phase one reopening with very good success. I don't know if you read our last week's newsletter or watched my broadcast last Friday, but we're following very strict protocols, including one patient in the building at a time, hour-long sessions, uh, 10 minutes of desanitizing in between patients, and following all the strict guidelines such as 6 foot distance and masks and the whole deal. And I think people were pretty pleased. We had to limit some of our hands-on treatment, obviously, but I was able to help people that had some recent injuries and also people that had some post-surgical needs. They had these surgeries before the shutdown and their therapy kind of stopped, so we picked that back up. We also had some of our GFIT people, that's my medical exercise program, come in and exercise one-on-one, which they really like because normally we exercise in small groups. We were kind of always socially distancing, which is what's great about my program. Imagine coming here and only working out with 6 people. It's a lot better than going to a gym and being around 75, 80, 100 people, depending on what peak hours you go. So I like to think of our GFIT program as already a socially distancing type of experience, but one-on-one's even better. And at least that's going to be that way for a while until we move into phase two. So we're excited to have everyone back. And as an extra incentive, anyone who comes back and takes advantage of our one-on-one sessions, we'll let you get on our Therasage hydro massage chair at the end of the session for a little relaxation. Couple things in the news. Governor's expanded testing sites free to the public. I think the free testing site offered at the state level is at the UTC Mall up in University Boulevard. They limit it to 400 tests a day, so you're going to want to get there early. There's no scheduling required or referral from your physician, but you can do that as well. Um, Also in the news, I think the beach concession stands and rentals are opening up on Monday. You could already go to the beach this week, but it's basically full service as of Monday. I think you probably all see the increased traffic and activity. I think people have generally been pretty responsible with the social distancing and minimizing unnecessary trips. But obviously, people have to live their lives, and I understand that and respect that. So, in terms of the statistics, I think the last time I looked at the statistics, which was 2 days ago, it was about 400 cases in Sarasota County and about 51 deaths. So that's about a 12% death rate. Keep in mind, death rate in Florida is about 4.5% as a whole. It's going to be a lot larger in Sarasota County because of the age population. It's much an older population, so obviously, if you're older and you get infected with COVID, there's about a 12% chance of death, and even higher for people over the age of 85. So the older you are, and the more comorbidities you have, the more you really want to try to minimize your outings and minimize your social interactions. Um, but again, everyone that came into my building, they followed all the rules. They seemed very comfortable with it. They were happy with the cleaning and the sanitizing that was occurring, and that's great. Um, and For everyone coming back, we offer a free Therasage hydro massage at the end of the session so they can kind of finish off their session with the relaxing massage. Today's topic, in terms of topic of interest today is prolotherapies and regenerative medicine, which you may have heard about. Maybe you've seen a commercial on TV. It's a new area of medicine. I think it's a really important area of medicine because pain management and pain medicine, particularly using prescription medications, is on the decline because of the risks of opioid addiction and abuse. So what we're basically doing here is um, uh, uh, encouraging people to explore a newer type of management for their arthritis. So we're talking about spine pain, knee, shoulder, and hip pain, basically the big joints in the body. And people that aren't quite ready for surgery or don't want surgery and tried pain management or have chosen not to go the pain management route. Um, so Regenerative medicine, which is kind of like the umbrella of area of treatment, can include prolotherapies, which are certain medicines injected into the joint that help to restore, rejuvenate the tissues that naturally occur in your body. Um, One example of a prolotherapy would be plasma-rich protein, which they actually take your blood, they spin it uh, in a centrifuge, and they pull out the plasma-rich protein out of the blood, and they go ahead and put that back into your joint, and that helps to proliferate the tissue that's damaged or inflamed. Taking that to the next level are stem cell therapies, which a little bit more cutting edge. Research isn't quite as supportive, but I just think that's because of the lack of research that's happening, particularly in this country. Many countries are ahead of us in stem cell therapies, and that's mostly because it's somewhat politicized with where they harvest those stem cells. Um, they can take it from your own body, or they can use umbilical cord or fetus, and that gets kind of complicated because most of the stem cells are being harvested from your own body. It becomes kind of an expensive endeavor. Don't quote me on this, but some stem cell therapies for orthopedics I'm hearing are 15, 20, $30,000 for a procedure. The ones that I've been involved with on the post-procedure rehabilitative phase, I've seen some really good outcomes. And if you want to ask for a referral from me, I'm not going to plug anybody here. There's a physician in town that I really like and hope to work with more closely. Um, but I think regenerative medicine and prolotherapies and stem cell therapies are an exciting and cutting edge field. I think it offers people an advantage who are avoiding surgery, especially right now. Not elective surgeries are going on, and even when elective surgeries come back, the surgeons are going to be backlogged, and they may end up not even offering you that until they've caught up. And remember, some surgeons do 6, 8, 10 surgeries a day, depending on how much help they have and the facility. And you can imagine a backlog of 6 weeks or so. So they also might take patients that are a little bit more higher risk for developing complications and just not offer them at all. So um, regenerative medicine, you can Google it, look it up. You're probably going to see some good stories and some not so good stories, but I do think that's the wave of the future, and I think the knife and pills is something that's going to be kind of last resort stuff. Anyway, that ends today's weekly rounds. Our Active Age newsletter should be coming out tomorrow because that's technically the end of the week, so look for that to hit your inbox. And I'll see you next Friday for another weekly rounds video cast. And again, if you're interested in a one-on-one session with myself during this phase 1 reopening, give us a call, email us, go on our website. You can chat with us online, and we'll get you set up and take care of you. Dr. Matthew Korn, 65 Plus Center for Active Aging, and we'll see you next time.